go.
Oh, hey Canada. My name's Trent Gordon. I'm working here at the Gillies Group in London, Ontario at Western University. So my work here focuses on the development of an intra-articular drug delivery system for the treatment of osteoarthritis. Osteoarthritis is a degenerative disease that breaks down cartilage in the knee. And the problem with current treatments is that the knee joint is avascular, meaning that if you start to take non-steroidal anti-inflammatory drugs, they're not going to actually treat the knee joint at the source of the pain, the synovial membrane. What I'm working on is delivering the drugs directly to the source, especially since if you start taking these drugs, they can have a large effect on the individual. A lot of people who have osteoarthritis are older, and when they take these drugs, they can cause stomach ulcers as well as cardiovascular problems. Now, my delivery method is a polymeric drug delivery system, meaning through an oil and water evaporation method, I can encapsulate drug inside of polymer, where after injecting it into the knee, it breaks down slowly over time, releasing the drug. Now, the way that I'm actually going to be making this delivery system is through the use of polyester amide. And what I like about polyester amide is I like the fact that it breaks down naturally in the body through enzymatically and hydrolytically. This is fantastic because then there's no bioaccumulation of the particles. Additionally, this drug delivery system is incredibly tunable. Just by changing the length of the dial, I can change the release properties of the delivery system. And this is really important for patient-specific healthcare. Now, I have made these particles several times and run in vitro cell assays on them, cell toxicity MTT assays on ACD-T5 cells. What I found is that the particles are inherently non-toxic to the environment, to their host. So what I was lucky enough to be able to do is actually implant them into sheep. And we got some really exciting in vivo results. We found that there was no host response from these particles. And I'm proud to say that that was an incredible discovery, as we can use this system not only for non-steroidal anti-inflammatory drugs, but for, in theory, any sort of encapsulation of any drug you want. Cancer treatment, osteoarthritis treatment, anything out there, we can do it with this delivery system. So I'm super excited to share this result with everyone, and hopefully with this, help people and potentially save lives.